everyone, and good afternoon to all the students and parents who have been able to join on time today. First of all, I'd like to thank you all for making some time from your busy schedule or making some time from the weekend and attending this most valuable webinar. Um, the agenda or this webinar is basically designed to provide students, prospective students, with valuable insights and some practical tips as to how to crack medical admissions in the UK. So the agenda for today is going to go as follows. I'm going to first talk a little bit about Gyanberry and how can Gyanberry help you. And then I'm going to start introducing our panelists. As you can see, we have two wonderful ladies available on the call, and I'm going to be introducing them after I finish talking about Gyanberry, who are going to be talking about, who are going to be basically responding to several queries that students have pre-stated during the registration process. Okay. And then towards the end, I will be displaying the contact details of Gyanberry so that you know who you could reach out to if you have further questions. Now, Gyanberry's mission is to make university admissions faster and easier. That's only because whatever we are today, we are because of the students. And it is our utmost priority to simplify the admission and application process for students as much as we can. We are a company that is 10 plus years old in the industry, and we're approved by KHD at Dubai. We're also having a dedicated team of 25 plus counselors and admission officers. We are also known as the industry leaders and trusted brand for medical admission, and we are the regional exam center, the authorized regional exam centers for a couple of countries like Czech Republic, Hungary, and Italy. Now, how can we assist you? So if any one of you or the students have to get in touch with us to take our assistance to medical universities, what is it that you can take advantage of from us? So we assist with destination and university planning. So if you are someone who is still confused as to how to go about with the process of applying to universities or which is the right universities to apply to, then we can help you shortlist the right university. So we have something called university planning, where we specifically understand your requirements and accordingly recommend you options. Apart from that, we also handle the entire admission and application process. So all the way from document checklist, document review, filing the applications, coordination with university is handled by the Gyanberry team. We also have online self-study materials. So we have self-study materials for several kinds of exams. So we have for the UCAT exam, which is for UK. We have materials for the European medical entrance exams, etc. Not just self-study materials, but if you are someone who requires a little bit of push, then we also have prep classes in place that are going to be conducted through our world-class tutors, and they're very well available. So we have group classes and individual classes that you can choose from. We also train students on interviews. So if you are looking for training, for getting trained on the multiple mini interviews, which is called the MMI interview, or just a normal motivation-based interview, we have experts in place who can do that as well. And if you are a student who is not graduating anytime soon and you're graduating, say, 2 years from now or 3 years from now, then we have exciting summer school and internship opportunities that you can take advantage of through us. And last but not the least, we have the student visa assistance that we can provide to you. Now, as I covered in the previous slide, we will be having some preparation materials, but specific to UK, since today's webinar is completely focused on medicine in UK, I'd like to highlight three features. So we have one of the service, which is the UCAT diagnostic test. So if you are a student who is in the process of giving the UCAT exam, then we have diagnostic tests, which is a replica of the UCAT exam. So you can give this exam, you can try it out and see how much you're getting out of the 3,600. And you can also identify areas which are weaker and you can start preparing on those areas before you actually give the final UCAT. Apart from that, we also have mock tests and we have online tutoring classes for UCAT starting from August. So for, like I mentioned, we have group classes and individual classes. So if you are somebody who likes to study in groups, then we have a group class coming up next month. And if you are somebody who dislikes group classes and wants a focused environment for studies, then we have one-on-one session with the experts as well. Now, we are actually very thrilled to invite two of our panelists. They're here to share the wealth of knowledge and experience that they have in the field of medicine in UK. So I'd like to first introduce Grace Wheeler. She is a final year medical student at Oxford University with over 1,000 hours of tutoring experiences. She has aced the UCAT and BMAT, excelled in both MMIs as well as panel interviews, and secured offers from all the UK medical schools that she's applied to. She specializes in guiding students through every step of the admission process, all the way from, university selection, exam preparation, personal statements, and interviews. So that's Grace Wheeler for you, everyone. She's going to be there to answer the questions. And second is Diandra Bretfelean. So, as a fourth year medical school student at Keele University with a BSc Psychology and an MSc Drug Design, she brings a unique blend of expertise to the tutoring sessions. Originally from Romania, she has over a year of tutoring experiences and is passionate about coaching students to excel, in medicine and in medical interviews. And she also has work experience as a medical reviewer in the pharmaceutical industry, and she's well equipped to guide students towards achieving the best potential in the competitive field of medical admissions. So, thank you once again, Grace and Deandra, for making time and attending today's webinar. Okay, so and now we can dive into the Q&A. But before we, get into the serious questions asked by the students, I'd like to just put out a light-headed icebreaker just to warm up everyone. So basically, if you could just share your experience, or you could let us know what inspired you to pursue medicine. Maybe both of you can give your input slightly, and then we can begin with the questions.
So I had quite an untraditional route into medicine. I think a lot of people say, oh, you in order to go and study medicine, you have to have wanted to do it from the day you were born. And that definitely wasn't the case with myself. I was interested in lots of different things, from law, from teaching to medicine. Unfortunately, my granddad fell quite ill quite young with a Alzheimer's is a type of dementia, and most people get a sporadic form, which comes along with old age. But my family, unfortunately, have a gene, which means that we can get Alzheimer's quite young. So I spent a lot of my childhood years. He was in a care home for 15 years. He was in 10 different care homes, and I spent every Wednesday for the first 15 years of my life visiting him in these care homes. And I think that just, without realizing, unconsciously made me want to go into medicine. I saw the impact that not only like doctors had, but carers had. And it really inspired me to want to go and help people like my granddad.
Great. Thank you very much for sharing that. How about you, Deandra? Would you like to also put in your experience?
Very similar to Grace. I didn't want to be a doctor since the day I was born. So I've tried different degrees. I've tried to see what I really like before I actually jumped into medicine. So I did psychology and then drug design. I worked for a while. And then I decided to do work experience in one of the hospitals in the UK. And as soon as I stepped into a surgery theater, I was literally like, I was so inspired to the point I have to do this. So that was the turning point for me. And since that day, I want to be a surgeon, and I haven't changed my mind through the medical school. So for me, it was that moment, just taking an opportunity to explore different areas and see what I actually really like. And I don't regret studying medicine. I think it's for me. So yeah, that's why I wanted to study medicine.
Great. Very, very nice to know that, you don't necessarily have to want to be a doctor since childhood. It could be a passion or an motivation just that just happens. So Very nice to hear, and I'm sure students are also listening to the same. So, without further ado, I'm going to start with, asking the questions, and I'm going to juggle the questions between Grace as well as Diandra. So, I will probably put out the question, and I'll put out the name of the speaker, so you can accordingly unmute and answer to the query that I have. Okay. So, the first question is, what is UCAT and what are the components of UCAT? So maybe Grace, if you can talk to us a little bit about UCAT and let us know about the components.
Yeah, so the UCAT is a medical school admissions exam used in the UK. It has 5 parts to it, 5 sections. So verbal reasoning, abstract reasoning, decision making, quantitative reasoning, and situational judgment. And the reason that medical schools introduce admissions exams in the UK is because there's quite a variety of schooling systems within the UK. And students get exposure or better support through A levels than others. And medical schools wanted to make the process a bit fairer. So they introduced this admissions exam, which isn't to do with any knowledge you already know. It's nothing to do with the biology you might be studying at A level or GCSE, the chemistry, the maths, the physics. It's an aptitude test, and more to do with problem solving, which obviously is very important as a medical student and as a doctor. It's very, very time challenging. You often only have like 40 seconds to answer a question, which is very, very difficult. And I tell students to this day that I'm in my final year at Oxford now, and it's still the hardest exam that I've ever sat. And I sat this 6 years ago, and it's still very challenging. But it encompasses all the elements and skills that are really important for a medical student and doctor to have. So being able to cope with pressure. The NHS is a very pressured place at the moment. So pressure, time pressure, being able to like think on your feet and problem solve. And they do that through the 5 different sections, and each of them focus on a different core skill. So for example, in verbal reasoning, you have a big passage of text, and you have to go through that text very quickly and pick out the salient points. And that's quite important. Often when we speak to patients, they'll chat for minutes and minutes and minutes and give us lots of information we don't need. And we have to be able to pick out that really important information. So it's these sections that are setting you up to see if you've got the skills that will be required to make a really good doctor. That in a nutshell is what UCAT is, and I'm sure we'll go into a bit more detail in other questions.
For sure, that's very good to begin with. I think that's a lot of information too. So of course, like you mentioned, it is pretty competitive to give this exam. So how beneficial it is for students to begin preparations early? Like, would you recommend it? And what would be like a timeline that you would be asking students to start preparing for the UCAT?
So again, it depends on when you sit the UCAT exam. So the window for sitting UCAT opens, I think, at the very end of July through to the end of September. So there's over a 2-month period in which you can go and sit your exam. So obviously, if you're sitting your exam in the start of August, and you should be starting earlier than people who are sitting at the end of September. So it depends on when you've booked your exam. And again, it's tailored to every individual. I'm not someone who, I don't think you can cram the UCAT, but I've never been a crammer anyway. I recommend, for me personally, I did roughly like 2 months of prep. So I started 2 months before I had to sit the exam. And that fitted in line with when I had my A levels at school. So often we sit our exams at the end of June. I wanted to focus on my school exams first and ensure that I got the good grades that are required to get into med school anyway. Because, there's no point working really hard on the UCAT if you're not going to get in because you don't have the grades that they need. So focus on getting the grades first, and with the UK timetable that kind of works in June. And I sat my exam in September. So I worked from the end of June through to the mid of September doing UCAT. And when you get closer to the exam, you want to be doing more and more hours. So I was roughly doing around probably 5 hours a week to begin with, maybe doing 1 hour on a weekday and a couple more hours on the weekend. And then getting closer to the exam, I was building up, and I was spending roughly 3 or 4 hours a day doing it. And in terms of the benefits of starting, like preparing early, is, as we've said, it's a very tricky exam, and it's very time pressured. And if you start early, you get used to working under that time pressure. You can work out where your weaknesses lie and focus on your weaknesses. A lot of the students that I've tutored in the past, they say it's 5 sections. I'm going to equally split my time between those 5 sections. And whilst it's very tempting to do that, you will naturally be better at some sections than others. And it's really important that it's very tempting to be like, oh, I'm quite good at abstract, I'm going to do more abstract. But you want to be spending your time on the sections that you're weaker at, and you're only going to work out which ones you're weaker at when you've done more practice. There's also particular sections like abstract reasoning, which is all about you spotting patterns. And the more patterns you've seen before, the more likely you are to spot them again. So with like most practices, whether you're doing revising for biology, for chemistry, for UCAT, it's all about just practice, practice, practice.
Great, great. Thank you very much for that insight. Maybe I'll ask another question to Diandra. So I think there's a lot of questions commonly asked by students regarding doctor shadowing. So could you put a little bit emphasis on, is it very mandatory to have a doctor shadowing experience in place? And what kind of doctor shadowing would be recommended? Could you let us know a little bit on that?
Yeah, so it really depends on the university if it's mandatory or not. So for example, for my university, it was almost mandatory to have some volunteering before you went into apply to medical school, but some universities it is not part of the admission process. However, I strongly recommend to do it because every single applicant will have some sort of shadowing experience of volunteering. And by having this, you will certainly have an advantage. And it's not just about how it looks to the examiners or the interviewers. It's about you and how prepared you are to acknowledge the realities of studying medicine and of being a doctor. And I think it opens your eyes in terms of, is this career really for me? So I really recommend it to do it for yourself first and just to test if you really like it. And as a bonus, you will get some extra things to talk about in the interview. So whenever I coach students about MMIs, I always say, give examples from your experience, from shadowing, from volunteering, because you can find relevant examples for almost any questions they ask there. And it would really put you at a really big advantage having some shadowing experience or even better volunteering experience. And in terms of finding shadowing experiences, I think a lot of students struggle with that. So I can only give example of what I've done. I literally went online and found emails of doctors all over the country, or you can use LinkedIn if you're that kind of person. Obviously, some people are not very extroverted. So as myself, I didn't have any connections to doctors. I didn't know any doctors. So that's how I found shadowing experience. I emailed everyone explaining I want to study medicine. Are there any opportunities in your hospital? And it took me around a week or two to find someone. And by doing that, I managed to do 2 weeks of shadowing, rotating through different specialties in the hospital. And that was the most valuable experience I had for the interview. And I think it really put me at the big advantage compared to other applicants.
Interesting, interesting. Yeah, I mean, of course, like you rightly mentioned, I think it also depends. Like you have to be that, go-getter kind of a person who can actually get out of the comfort zone and try to look for, opportunities available. So that's a great insight. Great. Also, regarding the doctor shadowing, is there any particular, like, could you let us know if there's any particular hours that need to be completed? Like, say, for example, if there's a university that requires that doctor shadowing or, volunteering services, then what is the recommended number of hours that students are looking into?
Obviously, the more hours you can do, the better, but we have to be realistic with exams and everything. I think as a minimum, I would say a week or two, because in a week, I think you can get an idea of what happens in a hospital, how to interact with patients, how doctors work. Obviously, the more, the better, but as a minimum, I would recommend a week. And as I said, I think, in my opinion, this is just my opinion, doing volunteering work is way more valuable than just doing shadowing, because during volunteering work, you can actually get to talk to patients and you will have a better interaction with them. Whereas with shadowing, you just observe, which in itself is a very good experience and very good things to reflect on. But if you want to be really hands-on, I recommend doing volunteering.
Okay, that's also very good. Thank you for that. Now I come back to Grace. So in continuation of the questions that I had related to UCAT, how do you recommend students prepare for the UCAT? And, could you let us know if you have some recommended techniques to prepare for UCAT that students can probably take a note of?
So first, I think it's important to try and work out how you're going to approach each section. So verbal reasoning is the first section that comes up on the UCAT. And as I mentioned before, you get a big passage of text, and then you have 4 questions that you have to answer regarding the text. So it might say, which of the following statements does the author most likely agree with? And you pick one of the following 4. And what's largely recommended online is that you read the question first, and then you speed read the passage. And it really depends on how you work as a person. I have quite a good short-term memory, so I actually read the passage first and then read the question. And that works best for me. So whilst I did mention that UCAT is a very time-pressured exam, I think when you're first starting off, put the time to the side, because you need to work out what works best for you. And then later on down the line, we can hone on timing. So sort of try your best to forget about the time pressure and say, I'm going to do this practice exam on verbal reasoning in this one method. I'm going to do the whole thing where I read the passage first and then answer the questions. And then the next day, I'm going to do it the other way. I'm going to read the questions first and then read the passage. And you can compare your scores and see which works best for you. And when you've worked out which method works best for you, stick with that. And then we can hone down on, getting you faster. There's lots of tips and tricks with UCAT, particularly looking at the language that's used in the questions. They love to interchange always and sometimes. So in the passage, it might say, sometimes ... and your question will say, always this happens. And that would be false, because it doesn't always happen, it sometimes happens. So a lot of it is playing at the UCAT game, I call it, is you can actually look at the language even without looking at the passage. And I say, if there's something which is so strong, like always or never, I am very reluctant to select that as my answer. And when I tutor people for the UCAT, this always sounds counterintuitive, but I tell my students that you're not actually aiming to focus on 100% of the questions, because that's impossible. There's evidence to show that students who put all of their time into 70% of the questions actually score higher, because you're more likely to get the 70% right than you are if you're doing a half-hearted job at the 100. And that doesn't mean you're not going to answer all the questions. There's no negative marking in the UCAT exam. So you want to make sure you've answered all of them. So when I tell my students focus on 70, I'm still saying answer all the others. But you can answer the other 30 that you're 30% you're guessing by using techniques like I just mentioned. So you're doing an educated guess. You're looking at the answer options, and that says always. Always is quite strong, it's probably not that. The next one says never, is probably not that. And the UCAT classes that you're mentioning, I'm running the group ones next month, so I can obviously give a lot more detail on how to go through each of the sections, but that's an example for how you can sort of combat verbal reasoning. So once you've worked out what technique you're going to do for each of the sections, it then is just doing practice, practice, practice. So as many questions as you can. The UCAT is a 2-hour exam in total, which I don't recommend students always sitting down and doing the full 2 hours, at least not until you're quite close to your exam, because that is just exhausting and it's not realistic. You've got schoolwork, you've got volunteering. There are certain resources, like you mentioned, Gyanberry has a lot of resources, which I'm sure are really useful as well. There's free resources available online too that you can use. I recommend just focusing on a section a day, being like, today's my verbal reasoning day. I'm going to work on this, do half an hour of verbal reasoning, and the next day do something different. That's what I'd recommend.
Excellent. I am, that was very nice. And I think it's really helped and given a lot of insight regarding UCAT techniques and preparations. So I hope students will be using this in the coming up UCAT exams that they would have. Great. So now I think what our students would definitely want to hear before we proceed to the other sections So we've covered UCAT, we've covered doctor shadowing. Now, could you both provide your experience in your respective universities? For example, how is your experience with Oxford University? And likewise, Diandra could talk about her experience in Keele University, just so that our students have two different kinds of experiences in front of them. So, yeah, you can go ahead, and then I'll ask Diandra to talk about her experience.
Um, I've had a very fun time at Oxford. Unfortunately, it was impacted a bit by COVID, which hopefully when you guys go to university, you won't have that difficulty. Oxford is a very traditional university. It's one of the oldest universities in the world. I'm very, very fortunate that it's been ranked very highly for medicine. I mean, all the different rankings say different things, but the one that we like to use, which is Times Higher Education, have ranked it best in the world for 10 years. So I've been very, very fortunate to have trained here, and it's set me up, I think, hopefully really well to work as a doctor. It's, I think, very different to Keele in lots of different ways, and it depends on your learning style as to what you'd prefer. But for Oxford, we have the traditional preclinical and clinical split, which means we spend 3 years preclinical doing very lecture-based, classroom-based learning. And everyone who does medicine at Oxford does an additional degree. It's called an intercalation. You can intercalate at most UK universities, but at Oxford and Cambridge for medicine, it is compulsory. So I have a Bachelor of Sciences in Medical Science, and that was an accumulation of the work I did in the first 3 years. So we have very lecture-based, we'd have roughly 10 or 12 lectures a week. Something that sets Oxford and Cambridge apart to other UK universities is we have a tutorial system. So Oxford is a collegiate university, and there are 39 colleges. 31 of them are undergraduate. So I go to Exeter College, that's an undergraduate university. Aside from me, there's 4 other medical students at that college, and we would have 3 tutorials a week where we'd sit down with some people who are leaders in their fields. My cardiology tutor is one of the most well-known cardiologists in the UK. He's sponsored by the British Heart Foundation, which is a big charity in the UK, for the work that he does. And I sit down with him once a week with one other student, and we talk all things cardiology. And that's a really good opportunity to bring up anything in the lectures that you didn't understand, because you sit lectures as the whole cohort. There's 200 of you in a lecture. You can ask questions, but if 200 people are asking questions, you'd be there for a very long time. So in the tutorials, you discuss the work you've done that week. You often have essays that are set for you. It's very, very work intensive. Because I was doing 3 essays a week, and each essay is like 2,000 words. So I'm churning out 6,000 words a week, which was a lot, as well as attending my lectures, attending my labs, attending my dissections. That was the first 2 years. In the 3rd year, I then intercalated. So whilst you have to do an intercalation of medical sciences, you choose what area you want to specialize in. I was very interested in infection and systems neuroscience. So I did a lab experiment looking at the 1918 influenza project, wrote a dissertation, and then sat my finals and got a degree. And then in years 4, 5, and 6, you spend most of your time at the hospital. And we rotate through different placements. So right now I'm on a surgical placement in vascular. So it's quite different. Not many universities in the UK have that traditional split of preclinical and clinical. There's definitely pros and cons to that. I would have liked to have seen patients earlier. But I think by the end of it, no matter what university you go to, by the end of the 6 years, you have the same amount of patient exposure. It's just Diandra might have had it, spread out throughout the 4 years she's done, whereas I've had it very intensive in the past 3 years. So I think it just depends on how you work best and what you're looking for from a med school.
Interesting. Thank you very much, Grace. Diandra, would you like to share yours?
Yes, so I also enjoyed my time in the university, even if it was stressful at times. There's so many positives to studying medicine. As Grace said, different universities have different formats in how they teach medical students. So at my university, it's more emphasis on patient engagement. So we got that from year 1. We had to do a community placement. In year 2, we had to do a general practice placement, and these are preclinical years as well. So in year 1 and 2, the emphasis is on learning the science, learning the basics, lab, anatomy. But at my university, they tend to give you that patient exposure from year 1, simply so that when you entered clinical years, it's not a shock to you and the transition is a little bit smoother. And from years 3 to 5, I'm now entering my 5th year. It's mostly patient engagement. So you spend your time in the hospital. It's also almost like a 9-to-5 job in the hospital that you don't really get paid for, but you have to go every day to your placement, and in between placements, you might have lectures, tutorials, seminars in which they teach you the necessary clinical information that you have to know to be able to interact with patients. And in terms of why I chose Keele is simply because it has it's like the groups we are in, they are smaller. So in total, I think we are 150 students, and we are split into different groups. So groups of 7 to 10 students, and all the teaching is based on that really small group of students. And I think, in my opinion, this gives you a better teaching experience with the tutor or whatever doctor teaches you. Because, for example, if you're very shy and don't want to ask questions in a big lecture hall, because that's really scary, even for me, it's also more, you will feel more comfortable to ask a question in a small group setting. And also, it's a very supportive environment. Everyone is friendly. I never had to go into a class or lecture and feel very nervous. Everyone is there to support you. If you ask a question, even if it might seem a stupid question, they help you. No one is judging you. The teaching experience, I really, really liked it. And I think that's what's the hallmark of my university, is that very friendly teaching environment. And for me, it really suits my studying style. Other people like other teaching styles, but for me, this was very, very helpful.
Interesting. So thank you very much. It was so nice to know about the 2 different universities and what they have to offer. And yeah, thank you very much for that question. Now, Diandra, I have a couple of few questions for you as well. And these questions are going to be centric to the MMI interview, the multiple meaning interview. So to begin with, could you please let us know of what is the MMI interview and what are the various components that students are looking at? What are the possible topics or scenarios that they're going to be putting forward?
Yeah, so the MMI is called the multiple meaning interview, and if you got this far, it's very good news. It means your academic records, your UCAT scores, everything is great. So getting to this stage, I teach my students to see it as an opportunity to bring their best, because this is what's going to set you apart from someone who gets into medical school versus someone who doesn't. So I think it's a very crucial part of the application process. And they usually last around 2 hours. It really depends on the university, but you rotate between different stations, and each station typically lasts 10 minutes or less. And between each station, you will get a few minutes to read a bit about the next station. So you basically rotate between different rooms, or if it's online, between different interviewers. And each station usually has the different interviewers, and this can be lecturers, doctors, members of the public, patients, or even medical students sometimes. And they each test different skills that are necessary for you to be a successful medical student and ultimately a doctor. And in terms of stations, there's very varied types of stations, and each kind of station requires a different preparation technique. So, for example, you can get role play stations in which they bring actors and they ask you to play a scenario with them. And this is mainly to test, for example, communication skills or empathy skills, or how you think very fast on the spot. They also, most of the station tests your communication skills. And they could ask questions such as, in a traditional way of interviewing, why do you want to study medicine? Why medicine at this university? ask you questions from your personal statement, ask you questions from your shadowing, volunteering experience. And also sometimes they have a station in which they test medical ethics. So they bring a scenario and you have a discussion with the interviewer based on that specific scenario. In some stations, they also test your numerical skills. They might also give you a video and test your problem-solving skills, your analytical skills. So there's a very wide range of things they test in these interviews. But it's mainly to see how you are as a person. So they don't necessarily test your knowledge on any specific topic because you got this far with your academic records in the UCAT. Obviously, you're smart enough to study medicine. Now they want to know how you are as a person. Do you have empathy? Do you have skills such as leadership, communication, effective communication? Can you work well in a team? Can you problem solve? So these are the soft skills, how I like to call them, that they usually test in the MMI.
Amazing, amazing. Very good. So, I mean, since you've said a lot about the MMI interview, would you be able to shed some light about your personal experience with the MMIs? And probably you could list out 2, 3 stations that were probably challenging and how did you tackle it? You know, so that could also be a very nice insight to for our students.
Yeah, so I set, I think in total 4 MMIs, and they were each challenging in different ways. So for example, I think the most challenging one for me was the role play station, simply because when you enter in that station, you don't know what to expect. It could be any scenario. So in my scenario, the actor or the patient asked me to discuss about a very sensitive topic, and they started crying. And they cried with like real tears, and it puts you a bit on the spot because you first of all, you have to pretend that this is a real situation. You cannot think of this is just an actor. So that might throw you off a little bit because you don't know, okay, is this real, is this not? But students should treat it as if it was a real scenario with a real patient. And after, you have to say the right thing, because obviously when someone is upset in front of you, you don't want to make them more upset. So it's all about your communication skills and how you react to unexpected things, because personally, I didn't expect the specific scenario to come. And so it tests your ability to think on the spot, your empathy. But how I overcame this, I thought to myself, what if this was my best friend in front of me? What would I say to this person? So that's how I quickly overcame that station, which was very challenging, to be honest. In terms of other types of stations, we got some stations that were not really necessarily related to medicine. It was not a medical topic. So for example, we got a video of a person talking about global warming. And I was like, how is this related to medicine? And ultimately, you had to summarize everything from that video to an interviewer, and they will ask you questions from there. So I think what that really tests is what your ability to assimilate information, your short-term memory, your attention to details, your communication skills. So I wouldn't say to expect that all stations are related to medicine. They could be completely unrelated, and that could be a bit challenging because you expect to be a medicine interview, but sometimes they test very different skills that you wouldn't expect.
Interesting. Yes, it is pretty intimidating. I mean, of course, you need to prepare for these interviews, but there might be things that you're not ready for, and you just have to be confident and also. So great. That's a very good insight. So thank you very much, Diandra. Now I have a few more questions for Grace. So what academic qualifications would be typically required when you're applying to UK medical universities? So if you could just summarize what would be like an ideal profile of a student applying to a UK medical university.
First, I'll have to apologise because I'll be doing this in the context of the UK academics because I'm not well up with the like international equivalents. But annoyingly, each university has relatively different requirements. So A levels are the most recent examinations that someone will sit before going to university. We sit that in year 13 in the UK, and then most people will go straight from finishing the A-levels onto university. So every UK medical school has A-level requirements, and they're the minimum A-levels you're expected to achieve. So for example, Oxford requires A-star AA, and you have to have done chemistry. That's a requirement for Oxford, with one other science. So for example, I did biology, chemistry and maths at A-level. Weirdly, I think biology is far more important for the degree, but for some reason chemistry is the required at Oxford. That will differ. A lot of med schools, biology is required. So you do have to check on each of the university's websites, but the majority of people who go and sit medicine in the UK will be doing 3 to 4 A-levels, and they will all be sciences and maths. So the majority of people and my friends who are in my university did biology, chemistry and maths. So that's the minimum of what is required. However, my university know that unfortunately a lot of when you apply to the university, you apply in October for medicine, and you sit your A-levels in the June. So you're applying with predicted grades. They're not the grades that you have, they're the grades your teachers think you might get. And a lot of schools in the UK, unfortunately, will inflate grades. Not ridiculously, but if your teacher knows you need an A-star and they think you'll get an A, they might just say you'll go and get an A-star. And that's understandable. They want to believe in their students and give them the opportunity to get into the universities they want to. So Oxford and some other London universities, they like to look at your GCSEs. GCSEs are what we sat in year 11 in the UK, because they're the most recent grades that you actually achieved. They're not predicted, that you went and you sat the exam, you got those grades. So Oxford still require you to have a predicted A-star AA, but they look at your GCSEs to see whether that A-star AA is realistic. So now in the UK, GCSEs are graded between 9 and 1, with 9 and 8 being A-stars, 7 being an A, and 6 being a B. I sat my GCSEs when a while ago now, so I sat them when it was still A-star A, B, C, with a C being a pass. I had all A-stars in the 11 GCSEs that I sat, so I was not necessarily a safe bet, but I'd shown the university that I had the capacity to do well in my A-levels. So they're kind of the academic requirements. They don't look at anything else other than GCSEs and A-levels. The other thing that they look at heavily is the admissions exam. So for example, when I was applying to Oxford, it was the BMAT, not the UCAT. It's now the UCAT exam. But whether they invited you to interview was whether they even looked at you was if you had the predicted grades. Then everyone who applies to Oxford pretty much has the predicted grade. So that doesn't narrow anything down. So then 50% of whether they invite you to interview is your UCAT score, and 50% is your GCSEs. And then they rank everybody according to that, and they will invite the top 20% to interview. And then when you get to interview, all that matters is the interview, because everyone is invited to interview, has the academics, as Diandra was saying, is, they've shown that they're really clever. Now the important thing is that kind of the softer skills. So yeah, they're the academic requirements, and apologies that I don't know what the conversions are for the international equivalent.
No problem, no problem. That's completely fine, but I think it gives a very good overview of what are the important criteria or factors to be considered. I mean, yeah. So I think Diandra, you are an international student applying to the UK. So would you like to add anything, or maybe something that our international students could relate with?
Yeah, so I said my equivalent of A-levels in Romania, and in the UK they usually recognize, even if it's from abroad, they do the equivalent of A-levels. So whatever grade you got in your home country, they can convert that somehow into A-level criteria. So as Grace said, it's very important to do sciences, whatever the exam is. For example, I did maths, chemistry, and biology, because most of UK universities, they will have a look at what kind of subject you study at A-levels, and usually 2 to 3 sciences are almost mandatory. But for me, it was a bit different because I did a degree after my A levels. So because my degree was a science degree, they also took that into consideration. And overall, I met their criteria. So I'm not quite sure how it is like going straight from A levels to studying medicine. But I know it is possible because I do have some colleagues in my years that came, for example, from Greece, from all over the world, and they were able to get into medical school with degrees from the home country. So I know it is possible, but I think the main criteria is to do science, is to choose science topics.
Absolutely, absolutely. Okay, so there's another question I have for perhaps both of you. Basically, we would like, I mean, of course, so many students, there are a lot of universities in the UK, around 45 universities and 36 universities available for international students precisely. So how, how did you go about shortlisting the right university for you? Like, what are the various aspects or features that you need to look into a university while you're considering and shortlisting universities? So would you have some tips or something from your experience that you can share as to how did you finally arrive at the university that you've got into? And obviously from so many universities, I mean, all of the universities are equally good and they have their own requirements and all. So what is the right way of shortlisting a university? Maybe Grace could go first, and then I can ask Diandra to follow.
Again, I think I chose university off lots of different aspects. It wasn't just one thing that made me go, I'm going to go here. So with I'm a home student, so born and bred in the UK, applying to the UK. So appreciate it does make it easier for me to get into these medical schools because there's not like a cap on the numbers. I am only allowed to apply to 4. That's how it works when you're a home student and applying. You can apply to 4 medical schools. And all the medical schools I applied to were actually really different. It wasn't that every single medical school had the same teaching style. So I live in Manchester, and well, I live in Oxford because I study in Oxford, but my hometown is Manchester. And I quite wanted to be near my family. So I applied to quite a lot of some of the medical schools in the north of England. I didn't apply to Manchester because that would have been a bit too close to home. I applied to Leeds, for example. I really liked their teaching style. They have a similar teaching style to Keele, so you start seeing patients from day 1. I really liked the hospitals that they had there. So the factors that I looked into when applying to the universities, one, what is the teaching style like? I actually, when I was applying, didn't particularly want to do a traditional style like Oxford. I quite like problem-based learning, which Manchester do a lot of. You sit in a room and you get given a case and you learn everything about the different systems through that case. And I like that style. I like how, and they often tell you this when you start your clinical years, it's worth going into placement because when you see a patient with that disease, you can sort of hang your knowledge to that patient and you'll remember that patient and you'll remember the disease a lot better. So I really like the problem-solving style that Manchester have. I like the integrated style that Leeds have. So look into the teaching style and what works best for you. The next thing I looked into or thought about was research. So all of the universities in the UK, I mean, all universities, whether they study medicine or not, are very big on research. Universities are research institutions. The universities that are centered around London and Oxford are very research heavy. And so I had to think about, is research something I want to go into in the future? What do I want my career to look like as a doctor? Do I want to have a portfolio career where I do a few days in the lab and then I do a few days seeing patients? So that was something that I considered when applying. I also thought a bit about the city that the university is in. You're at university for 5 or 6 years. That's a considerable amount of time, particularly if you're an international student, you're going to be away from home. You might be in that city for the majority of the year. I mean, now even though I live in Manchester, which is 4 hours roughly on the train, I only go home 3 times a year. I only get 5 weeks of holiday now a year, the same as if I worked a 9 to 5 job. So I'm in Oxford all of my time. You want it to be a place that you like, that feels like home. So I think that's something important to consider, and even more so as an international student. And then the kind of like last thing I thought about was the practicalities of it. So how well connected is it to other places? How much does it cost to live there? What funding am I going to get from the university? Do they guarantee me accommodation, or am I going to have to live out? I think that last aspect, the practical aspect, is things people don't think about enough. They think about, oh, I'm going to go here because this is how it's ranked in the league tables. And it's funny that I'm coming from, I went to Oxford, which is ranked #1, but that wasn't what made me like pick it. Because at the end of the day, and I think this is even more difficult as an international student, and it comes back to like getting shadowing, is when you study at a UK university, they are prepping you to work in the NHS. They're expecting you to work in the NHS. Even if that's not your plan, when you go to interview, that's the stance you need to have. And anyone who sort of is, born or brought up in the UK understands the importance of the NHS to the public. It's a thing that British people are most proud of. There's been many, many polls and it's asked what's made you most proud to be British, it's the NHS. It is top time and time again. It's unfortunately struggling at the moment, but it's a thing that British people are so innately proud of. And it's that understanding that's probably quite difficult for international people to have just because you haven't grown up in it. So that's why trying to get shadowing or coming across the UK or speaking to British people is really important, because our healthcare system is incredibly unique. The fact that it's entirely public and free. So when you are, prepping for your interviews or like thinking about it, you have to think about things like hospitals. What hospitals do we have here? Oxford has brilliant hospitals, some of the best in the UK. Liverpool has brilliant hospitals. So they're things that I also considered as well.
Great. Thank you very much for that insight. How about you, Diandra?
Yeah, so very similar to what Grace said. I use the same criteria to choose my university as well. Also, after living in London for almost 4 years, I just wanted to be somewhere quiet, countryside based, and Keele was like that. It's not a big city. Literally, the campus is surrounded by woods and hills, and it's very countryside-like. So I really wanted that peace and quiet to be able to study medicine, whereas as opposed to being in a big city. Obviously, there's pros and cons to both, but for me personally, I wanted to be somewhere just in nature, me and my books, and just study. But obviously, people are different. So if you prefer to be in a big city like London, maybe location is very important in terms of university, and also cost. Studying in London, for example, it's almost double the rent as studying somewhere like probably even Oxford or like smaller cities in the UK. So cost is a very important thing to think about. And for me personally, because I knew that I wanted to go into surgery after, I also looked at hospitals and what kind of surgical specialties they have. So the hospital that I am now at, it's a major trauma center in the UK, which means the most complex trauma cases come there from all over Wales and all over the area, either by helicopter or like different means. So it's a very good trauma center. So it gave me that insight that probably I wouldn't have gotten from a different hospital. So thinking about your career long terms, what are your long-term goals with medicine? What kind of environment you want to study in? What are your finances? How would you feel, as Grace has said, at home? Because I'm an international student, and it was very important to have that community spirit, which I really get at Keele. And yeah, these are the factors that I took into consideration when choosing the university.
Great. Thank you very much. So, I think as you're an international student, Diandra, I wanted to understand, even like this is a question from the students, that do a lot of UK universities offer scholarships or grants or financial aids or even stipends while you're working, or while you're in your clinical phase? Could you elaborate a little bit on that?
I think my situation is just a little bit different because I'm also classed as a home student. So whatever funding I get the same as someone from the UK would get. This is because I studied there 3 years before I started my medical course. So from my experience, I do get some extra funding from the universities. For example, I get a yearly bursary from the university that I don't have to pay back. My university also has some support funding for, like, for example, if you want to buy a new laptop as a student, or if you want to get a gym membership, or if you have like some unexpected costs, they would help you with that. So there's loads of funding available for students who actually need it. And in terms of also, I get student finance as well to pay, which is called a maintenance loan. So they help, this kind of funding helps me with rent, for example. So it really, really depends. I'm not quite sure what the process is for international students, unfortunately, but usually there are loads of options university-wise that students who are struggling financially can actually get financial support from the university.
Absolutely. Thank you very much. That's also very helpful. Last section, because we have 5 minutes, I think we'll extend it 5 minutes more, like max 10 minutes for the remaining 2, 3 questions. So there's a question related to personal statements, which is also one very important factor to UK medical universities. So what are the essential elements for writing a compelling personal statement? So, I mean, if I would like to take the inputs of both of you all. I mean, of course, maybe Diandra, you can begin, and Grace, if you have something, additional to add on, you can add on after she's done.
I think the number one rule is to not just use a template that everyone else is using and say very cliche things that you would expect to say. So my advice is to make it personal to you. So why do you want to study medicine? Forget about what you would think people would expect you to say. If you have a personal experience, as I had also a personal experience before going to medical school, that's how I started my personal statement. So don't be afraid to be yourself and say what makes you unique. That's my number one tip. And the second of all, whatever you write there, be prepared to talk about it in the interview. So if there's something you're not very comfortable talking about, just don't write it in your personal statement. And as I said, yes, make it very personal to you, and don't be afraid to, in a way, show off. So if you have an achievement, whatever achievement that may be, make sure you put it in your personal statement, because that's what was going to set you apart from other students. And even if you think that achievement is not relevant to medicine, I'm sure it is. So for example, let's say you volunteer or you're part of a sports team and you're the leader of that team. You think, oh, this is not related to medicine at all, but actually it shows very valuable skills such as leadership, teamwork, discipline, and all of these things that are very relevant to medicine. So whatever you write there, even if you think it's not relevant, if you phrase the words in a way that you make it relevant to medicine, it can really, really help you in your personal statement.
Great. Thank you. How about you, Grace? Do you have something additional to add in?
Yeah, so you'll be applying to the UK universities through UCAS, like home students do, and they've actually changed how they're doing their personal statements from this year. So it used to be that you had 4,000 characters and you could write basically whatever you wanted. There was no new criteria you had to fill. They've now changed it so you get 3 structured questions that you have to answer. So those questions might be, they haven't released them yet, so I can't say what they'll be, but I'm guessing it might be something like, why are you suited to this course? And like Diandra was saying, that's sort of listing listing is not the right word to use. Talking about the skills that you have, and like Diandra was saying, that's why like volunteering and work experience is so valuable, because you can give examples of how you've displayed those skills. The best tip that I was ever given when I was writing my personal statement is never write anything where you haven't said what it's taught you or what you learned from it. So the most frequently used word in my personal statement was learned, like from this I learned, or this taught me that. Like whilst, and like this comes back to what Diandra was saying earlier, volunteering is like so valuable, because whilst it's great for you to do work experience for you to see, can you cope with the hospital environment, is that somewhere you can see yourself working in, the UK medical schools have a lot of pressure on them to be very inclusive and like Diandra, I have no family who are doctors. I didn't know anyone who was doctors. I did manage to get work experience through a lot of hard work. I traveled there. It took me 6 hours of commuting a day to get to a hospital that I could do work experience in. It wasn't easy. And my work experience was mainly, I didn't even spend a lot of time with doctors. I was doing like the tea rounds for the patients and things. But that is actually seen as being more valuable than standing in a neurosurgery, because I've seen a lot of students who will quote, "Oh, on my work experience, I stood in a neurosurgical theatre." That doesn't impress anybody if you haven't learned something from that. And you saying I learned the anatomy of the brain also isn't massively impressive. You'll learn that when you're at medical school. If you speak about, from that I was really astonished by the interaction between different team members, from the theatre staff to the doctors to the nurses, that's valuable, because a lot of the work in the NHS is multidisciplinary. So don't panic if you haven't had all of this like amazing experience, like you haven't been in different theatres, you haven't followed the doctor around. That's not what people are looking for. Like Dandra was saying, anything, I'm sure there's like tens of things that you've all done that is valuable. So being a sports team leader, even if you had a paper round and you've had responsibility, that's valuable to medicine. So I write a list of everything that you think you've done and see what skills you can link to medicine, and I'd start from there.
Excellent. Thank you very much for those insights. So, just in addition to the previous question, would you be able to provide us an example of a strong opening and closing statement that students could perhaps put up in their personal statement, or maybe if you could recollect what did you add in your personal statement and how did you divide your personal statement? So that could also be like an experience to share. So I like the input from both you as well as Diandra.
Yes, so
Yeah,
do
yeah,
I?
you can start talking.
Yeah.
Yeah, sure.
So what I remember, I started my personal statement with a story. So it was when I was shadowing, I did an accident and emergency shift. This was a night shift, so I stayed with the doctor overnight. And that's the first time I saw something very serious happening in the hospital. So it was a cardiac arrest. So I started my personal statement with that story. It literally started, it was 4 a.m. in A&E, and the patient did this happened, and this happened. And I think that's a very strong opening, because it shows that you were there and you start with something very relevant from your experience. So I think it was quite risky, I would say, because I think traditionally people don't start with that. But I wanted my personal statement to show who I am and to be a little bit different from other people. I'm not saying do this, because some university probably won't like it. But I took that risk and it worked out really well. So it really, really depends on how you are as a person, and make sure you show that in your personal statement, because what they're looking for is to see how you are. And yeah, that's how I did it.
Great, thank you. Yes,
Um,
Grace.
Mine was my first, so how I structured mine, and again, it will be slightly different because of the new structured questions, but you have like a 3 or 4 lined introduction, which is introducing you and sort of why you want to do medicine. So for Diandra, she saw this big event that happened in A&E. I'm sure that, like, seeing that for the first time for anybody is quite shocking. And for a lot of people, either make them run away or run towards the drama and want to get stuck in and help. So mine was, I think my first sentence was, I've been lucky enough to have good health, but my granddad has not. At the age of 52, he was diagnosed with early onset Alzheimer's. And then I spoke about how visiting him for 15 years and every week and seeing the interactions really inspired me to want to help like vulnerable people like himself and others. So that was my like very brief introduction. What I would say is, same with Diandra, is you want to be telling like a story. You want the people who are reading your personal statement to be able to like build up a picture of what's going on. So for Diandra, I'm sure you were trying to like build up a picture of the scenario, so the person reading the personal statement could felt like they were in the room, could sort of see what was going on, feel the sort of like palpable stress. Mine was obviously a bit different because I wasn't describing like a set scene, but for them to get a picture of me, who I am, and what's the things that have happened in my life to put me down this path of medicine. My personal statement ended up sort of having a bit of a theme of dementia. I never planned that when I was planning my activities, but I volunteered for 6 months in a care home on the dementia unit. So the theme of like dementia was sort of carried throughout my personal statement, and how particularly for people who apply into the UK, we have an aging population. 80% of people who are in the hospital are over the age of 65. So having some appreciation and showing the communication skills with the elderly people is really important. So I wrote quite a lot about that, and I did some work experience at AstraZeneca, which is, I'm sure you've all heard of it through the Oxford AstraZeneca vaccine, is a big pharmaceutical company in the UK. And they were developing a drug that was used for Alzheimer's. And so just by coincidence, the whole of my personal statement, and there's no need to do that, but it kind of meant that the person reading it could probably pin me as the dementia girl. Not that I want to be known as a dementia girl, but it gives me like a personality that probably made me like stand out. So if, I mean, you're lucky or unlucky enough to have a story like I have, which has a big impact on me, my family's life, then that's great. You can talk about it, but don't worry if you haven't. There's no requirement or need to have had this big personal story of something that's affected you. Like Diandra said, it's all about being personal. For me, it wouldn't have been me if I hadn't have mentioned that, because that is fundamentally the reason that has influenced me going into medicine. So if I was being honest, I had to talk about it. But I'm sure all of you have very valid reasons as to why you want to go into the field. And if you're coming across as being honest and genuine, then that's what they're interested in.
Great. This is great insights from both of you. And like you rightly mentioned, I think there's not, one particular format or, one particular topic to talk about in the personal statement. There's so many things that you can talk about if it is personalized. So thank you for that input. And again, thank you very much for all your patience so far with my questions. And we're almost towards the end. I just have one final, closing question, maybe something that you would like to share with the prospective students, like some tips and suggestions that you would like to give them when it comes to applying to medical universities, and how can they ace the admissions to UK. So just some quick tips and some, recommendations and then we will end the webinar. So we'll start with you, Grace.
Oh, that's tricky to only give a few. I would say don't overwhelm yourself and do like everything. I have students who enter every Olympiad going for biology, chemistry, maths. They volunteer at 7 different places. They take part in 15 different sports teams. Brilliant if you do that already, and I admire you for being able to split your time like that. But you'll realize that personal statement is incredibly short. These things are important to do, but I would just do one of each of those. Like I did my 6 months of volunteering, I did my week of work experience. I played badminton at school because I enjoyed it. I wasn't top achiever. I didn't do any Olympiads. I didn't achieve gold in any of them. I didn't do an EPQ. I just did my A levels well. I got the top grades in my A levels. I got a good admissions score. And unfortunately, obviously, we want well-rounded people. Universities will be looking for that. But at the end of the day, their bottom line is we need someone who can get the A levels, and we need someone who can do the UCAT, who gets a good admission score. Everything else is a bonus. So don't overwhelm yourself. It's a very overwhelming process being where you're sat now. I don't envy any of you to have this whole timetable ahead, but it is very achievable. I got into Oxford. I'm a first generation doctor in my family. My parents didn't go to university. I was the first person from my school to ever go to Oxford, to ever be sent for medicine at Oxbridge. And I managed to do it. So it's possible for everybody. Just take it one step at a time, and just try your best at the UCAT and the A levels.
Thank you. Thank you for that insights. And we'll end with you, Diandra.
Yes, very similar to what Grace is. I know it's a very overwhelming process, but make sure you also enjoy it because you're embarking on this very, very long journey. So it doesn't stop with your MMI, it doesn't stop with you getting into medical school, it doesn't stop with your preclinical years or your first exam or your last exam. It's a lifelong journey. So don't burn yourself out from the first few steps. Just take it step by step and make sure you actually enjoy the journey. Remember why you are doing it. And yeah, just take it step by step. And make sure you enjoy it. That's my main advice because you're going to be doing something very challenging for the rest of your life. And if you don't enjoy it, there's no point in doing it. So that's my main advice.
Great, great, great. So once again, I'd really like to thank you for such a fruitful session. I think both of you have wonderfully answered all the questions that the students have, and I'm sure that the students and parents feel much confident at this moment. And I'd also like to thank all the students and parents for your attention. And I'd like to share the screen and just provide you with the contact details of the Gyanberry counselors. So if you have any questions, post the webinar, please feel free to contact us on the below mentioned numbers, and or you can drop us an email and we will be more than happy to help. Once again, thank you very much, Grace and Ms. Diandra, for your time, and we will see you soon. Thank you.